So that gives you a little bit of an idea here. I want to also explain a couple other pitfalls that happen with horses. As the teeth are developing, I showed you that one skull where there was developing teeth inside the skull in the cutaway. The permanent teeth are underneath, this is the maxilla, they're inside the maxilla, and they're growing longer and longer, and their face will actually start to bulge. A lot of horses, when they're young, they're not actually as pretty in the head here, but they're all bulging up, especially like Arabian horses. I have miniature horses myself. They get really bulgy and they're not as pretty, and about 7 or 8, the face gets more refined. The reason that is because you get the teeth all crowded up inside the maxilla, and it actually swells the bone up. The bone actually stretches out. It's called a dental cyst. And as the teeth erupt, the roots pull away, and this all dries up, and they actually get more sculpted in the face as they get older. Sometimes when you see a 4-year-old, they'll be kind of not as pretty in the head, and when they're 7 or 8, they actually dry out, and it gets more refined and sculpted looking in the face. Also, you see the lower jawbone. They get a bunch of bumps on those. This is called a dental cyst as well. You can see that's lumpy right here. You all see that okay? See that it's not quite level there? I don't know if you can see it well from the back. That's a dental cyst also. That is, again, start with the tooth. That is essentially the tooth in the jawbone pushing against the bone. But like I mentioned, the teeth erupt, which means they're moving forward, supplying more tooth. Eventually the root will pull away from the jawbone, and when it does that, that'll all flatten out and go away. This is still a young horse, so that's why it hasn't happened yet. This one's about 4.5. So at about 6 or 7, that should be all flat. Sometimes you'll see horses with really huge bumps. It's usually the more refined the head, the more petite the jawbone. There's just no room for those teeth. Usually the more pronounced those bumps are, but like I said, they will go away. And sometimes, in this horse's case, it became a problem. These teeth actually erupted through the bone. Let's put that back in there. It was most likely the demise of this horse. Once in a while, this is rare, but once in a while, if there's no room, the teeth will actually burst through the bone and cause a major problem for the horse. I'm surmising that this is probably what took this horse out, what ended up making it die, because it had areas where the teeth were bursting through the side of the face here, and that would have caused the horse a lot of distress. Horses will go into colic if they're stressed out too much, they're in a lot of pain. They won't want to eat, and they get stressed, and one thing leads to another. Ironically, the teeth were done. They'd been properly done by someone who does similar work to what I do. The only problem is they didn't know, you can't always notice anything like this on the surface, it's under the skin. You would have to have the foresight to have taken an x-ray and then discovered that. But it's my guess that they just didn't notice that, and that's what probably caused the horse to die.
There is anything that can be done, you know that?
Yeah, there is things that can be done. You want these teeth here to erupt down as quick as possible so the root pressure on the maxilla is relieved. What I would have done is actually taken these out of occlusion. In occlusion means all teeth are touching. Out of occlusion means I would actually reduce these teeth shorter than normal. Okay, feed the horse pellets. You don't worry about hay at this point. And you want to give the pellets anyway, so it makes it less work for him to chew up. To grind up hay is a lot more work. Eating pellets and even soaked pellets most likely would be even easier for the horse. I would take them out of occlusion to speed up the teeth erupting. So as soon as the roots can pull away from the maxilla, that'll help that close up again. Plus, you'd have to have the vet involved. They'd have to be most likely, if they had infection there, the vet would probably, put them on antibiotics and anti-inflammatories. There'd be a whole series of things to do. It's a tricky problem, but if you catch it early, you can save the horse. If you don't, then obviously, and this is one of those things where the horse will be not wanting to eat, and they'll do all this blood work, and they can't figure out why the horse doesn't want to eat, because this is a very stealthy problem. It's something you just can't see that easily. You have to have the foresight to know where to look. It's kind of a process of elimination. It's like troubleshooting on a car. Your car's not running well, the mechanic will troubleshoot. Well, is it this, and they go through a certain line of possibilities, they finally find out what the problem is. Well, if the vet doesn't know this is a possible reason why the horse isn't eating, they can do all kinds of blood work and try to look for mysterious, more elaborate reasons why the horse isn't eating, and all along with the dental problem just undetected. So it's just really, it's an individual thing. It depends on the skill of who you have working on the horse. So hopefully the Mobius tools are making a little bit more sense to you now. Why I use them. They're not cheap to buy, but they're very much well worth using. These are canine teeth. Generally, canines are on male horses. They keep growing. They get longer and longer, and they get in the way when you're pulling the bit in and out. Quite often, the bit will get hooked up on these canines. This is an apple core grinding tool. It has a little curve to it, and what we use that for is we reduce the canines to around the height of the incisors or slightly lower. You never want to reduce the canines to the gum line completely. That causes another set of problems. The gum line starts to fall over the canine and then food builds up around it and you cause a problem. So you want to reduce them. These are actually too long. These are probably about half an inch long. They could probably be reduced half as much again. I usually have my canines above the gum line, about quarter inch tall, and that's so when you pull the bit in and out, you're not catching on the canines, and the upper ones as well. And that way you don't cause the horse to be suspicious about putting the bit in their mouth. When you catch the canines, some horses will get really apprehensive about opening up their mouth. That's the reason we trim the canines. Also incisors. Ideally, when you look at a horse's mouth, see, this is a straight one, yes it is. This is the one that works on actually. The incisors should be nice and straight. They can become uneven over time. Here's a picture here. I'll show you, this is not a really major problem. And this shows you the canines, by the way. Here's the canines before. You can see tongue damage. It was blistering the tongue and ulcerating the tongue. And then we reduced the canines, so in future the tongue will heal up and it won't have that problem. Here's the incisors. This is called a diagonal slant. It's high on this end, low on that end. And after incisor correction, it's straight across. That's done with this cutting wheel. Horses don't have nerves in their teeth like you and I do. So sometimes people are watching me do dentistry and they're like, oh my God, the horse must be in so much pain. I'm cutting a fairly decent section of tooth off. Their nerves in their teeth are constantly receding. Almost like the quick on a dog's nail. If you cut a dog's toenail, the quick recedes. It does that, it keeps repairing because as it's wearing into their teeth, if the nerve didn't recede, it would be sensitive. So it has a dentin and secondary dentin, and it keeps sealing off the root pulp, and it keeps going in. So you can actually cut quite a bit of the incisor off and not hit any nerve. And if you get close to the nerve, the teeth know that it's near the surface and it actually starts repairing and receding that and closing it up. So even if you grind some tooth away and you're getting close to the nerve, it will repair and drop the nerve down low so there won't be any sensitivity. But when you have experience, you know where you're at as far as that. There's like color changes when you're getting closer to that if you're doing an incisor correction. And I also do a procedure called a bit seat. A bit seat is, for people who ride, it's like night and day. You have a horse that's fractious, it's a monster, it's giving you all kinds of problems. Here's a rostral hook. Rostral just means to the front. There's a hook on the upper molar. And I'm going to pass the skull around in a little bit, showing you a before and after on a horse I did with a bit seat. What we did is we took the hook away, and we also rounded the front of that tooth. The reason we round it is when you pull on the bit, you pull that soft cheek tissue into a tooth. If the tooth has edges on it, that's going to cause the horse to become fractious. So here is